I'm Luti Kiros. That's my sister. Shake the phone, please. Thanks. And my speech is about overcoming substance abuse. Substance abuse rates are rapidly increasing every year in the United States. Consequently, more and more devoted families are losing their loved ones to lethal, addictive substances. This speech is for you. Whether your family member is dependent on alcohol, marijuana, prescribed medication, or other drugs, their dependence affects you and your family as well. But recovery is never out of reach. No matter how hopeless the situation may seem, or how many times one has tried and failed before, change is possible with the right treatment and support. Substance abuse is defined as alcoholism and drug dependence and addiction. As society progresses, this form of abuse is becoming more widely accepted in a sense. In more old-fashioned times, substance abuse was viewed as absurd, inappropriate. Today, it's perceived as more of a long-term and hereditary illness as opposed to a moral weakness. For many people struggling with addiction, the toughest step toward recovery is the very first one, recognizing that you have a problem and deciding to make a change. The chance of developing a substance use disorder depends partly on genetics, environment, psychological traits, and stress level. Researchers have speculated that using drugs for a long time changes the brain in important, long-lasting ways. It's as if a switch in the brain turns off at some point. This point is different for every person, but when the switch turns on, the person crosses an invisible line and becomes dependent on the substance. People who start using drugs or alcohol early in life run a greater risk of becoming dependent. These changes in the brain continue on after the victim has stopped using their substance. This is a red flag to the victim that they're indeed suffering from addiction. It's normal to feel uncertain about whether you're ready to start recovery or if you have what it takes to quit. But if you're addicted to a prescription drug, you may be concerned about how you're going to find an alternate way to treat a medical condition. Committing to sobriety involves changing many aspects of everyday life, like free time activities, how you think about yourself, and ways of dealing with stress. Because addiction is a chronic disease, people can't simply stop using drugs for a few days and be cured. Most patients need long-term or repeated care to stop using completely and recover their lives. Addiction treatment must help the victim stop using their drugs and be more productive. Many treatment programs employ both individual and group therapies. Group therapy can provide social reinforcement and help enforce behavioral contingencies that promote abstinence and a non-drug using lifestyle. A range of care with the tailored treatment program and follow-up options can be crucial to success. Treatment should include both medical and mental health services as needed. Follow-up care may include community or family-based recovery support systems. Treatment can include behavioral therapy, medications, or a combination. The specific type of treatment or combination of treatments will vary depending on the patient's individual needs and often on the type of drugs they use. Whatever treatment approach you use, having positive influences and a solid support system is essential. The more people you can turn to for encouragement and guidance, the better. Your chances of recovery will increase by a lot. Having the support of friends and family members is a valuable asset in recovery. If your previous social life revolved around drugs, you may need to make some new connections. It's important to have sober friends who will support your recovery. Try taking a class, joining a church or a civic group, volunteering, or attending events in your community. Sober living homes provide a safe, supportive place to live while you're recovering from drug addiction. They're a good option if you don't have a stable home or a drug-free living environment. Join a recovery support group and attend meetings regularly. Spending time with people who understand exactly what you're going through can be very healing. You can also benefit from the shared experience of the group members and learn what others have done to stay sober. Thank you.